2. 3 John 2, and I'm just going to turn over there. And this is not planned because this is the fourth Sunday, and I wasn't sure if Dr. Hayes was going to be with us or not. And so, but 3 John 2, we just want to turn there and just speak to a little bit about that. And we will do whatever the Spirit of the Lord says from that. But 3 John 2, if you are able to turn to that. And it is, I believe it is so applicable with all of the prayer requests and the things that people are experiencing, as Bishop Washington said, in our own right. Every one of us are experiencing some issue. And I'm just embarking upon the Lord to continue to allow us to be steadfast, to continue to walk in faith, to continue to depend and trust on and in His Word to carry us through, to guide us through, to bring us through the issue. But one of my favorite passages, and I could quote it, but I'm going to actually read it, is 3 John 2. And it says, "Beloved, I pray that you may prosper in all things and be in health just as your soul prospers." Beloved, I pray that you may prosper in all things and be in health just as your soul prospers. So when I heard that phrase, hearing heart, hearing health, and then the question, what are you meditating on? How are you maneuvering with what has been given to you? It just impacted my spirit, because there's so many times, and I've said it before, that we listen, but are we hearing? And I'm not being this is not towards anyone. This is just expressing. But there's so many times when people say they're hearing, but I question, are you listening? Are you hearing? Because I believe when you hear, you have come to a level of understanding. And when you've heard to the point of understanding, then you're able to do whatever it was that you've heard, that you understood. It can be kind of likened to the sower sowing the word and the seeds going on the various grounds. And the ground that actually does not allow the word to be snatched is the one that actually understood the word, understood the parable, and was able to harness that word in the soil in such a way that it is covered, it is shielded, it is protected, so that now it can be developed. It's like a seed being in the womb of a mother that is incubated until the time that it is ready to be given birth to. So that is how I see that word. So when it asks about hearing heart and hearing health, that just was profound to me this morning. And what are you meditating on? So I just wanted to share that with you. Whatever you are hearing, hear it in your heart and hear it to the point that it is health to your being. Because again, there are many physical issues that people are experiencing, but there are also many financial, emotional, social things that people are experiencing, and those things actually affect your actual presentation and expression of health many times. So I just want you to be cognizant, to be in tune with what you're hearing, and really pull on the Spirit of the Lord for the understanding that He has for you in that moment, because in that moment it's going to carry you to that next moment, that next level. So I encourage you to meditate on that, because according to 3 John 2, it is His will that we prosper and be in health just as our soul prospers. And we know that our soul is our mind, our will, our intellect, and our emotions. And our emotions are things that move us, that emote us. Whatever the situation, it is going to move us in a certain way. So it is His desire that we are prosperous in whatever that move is. So I just wanted to share that with you. And then the other thing that I wanted to share with you is that this has been the month of men's health. And if I've already talked about this, please tell me, because I teach so many things, so many days of the week. And I share so many things, but please let me know if I've shared this with you. But since Dr. Hayes is not able to be with us this morning, the Spirit of the Lord impressed upon me also to share about men's health. June again is the month that we celebrate Father's Day, but it is also designated on the National Health Calendar as Men's Health Awareness Month. So I had prepared a presentation for men's health. So if it is okay with you all, I'm actually going to share that this morning, unless there's something someone else wants to share. So please speak now or forever hold your peace. I'll give you like 30 seconds to let me know if this is okay or not.
Amen. Amen.
Okay, thank you. I have two. Where two or three are gathered together. So we're going on the third. So we have the first, the second, and so the motion is sealed. So I am going to share my screen with you, and I'm going to go over this PowerPoint. And some of these things, again, you may have seen before, but repetition is good and it empowers us. And for any of those who've known me for a length of time, I have a passion for praying for males because of the order that the Heavenly Father created, for the males to be the headship and the leaders within the homes. So I have a passion for praying for males. But right now, I want to share with you about men's health for this month of June. So let me get my screen set. And please, if you have any questions, write them down and I'll give you a few moments and we will go over those. So let me stop this particular view. So Men's Health Month. Um, so these are just some statistics that I wanted to share with you. Men are 17% more likely than women to have cancer. And then 50% of all
They're doing a
males,
thing today. Instead of,
Kendra, can you mute yourself?
oh, I'm sorry. I'm sorry.
No worries. 50% males are more likely than women to have hearing loss, and there's various reasons for the hearing loss. And I could give you a few examples, but we're going to move on. And 50% of more males are more likely than women to die of heart disease. And yet men are 50% less likely than women to seek preventive care. Not that men don't seek care, but more women than men seek preventative care, like doing preventative things. And so by the age 100, men are outnumbered 1 male to 8 women. That's just a few facts. So some other statistics to consider are that 450,000 men die of cardiovascular disease each year. And more than 700,000 men are diagnosed with a type of cancer each year. 300,000 of those cases will result in death. 230,000 men are diagnosed with prostate cancer every year, and it is the second leading cause of death in men. So you have heart disease, and then you have prostate cancer. My grandfather passed away of prostate cancer. More than 60% of adult American men are overweight or obese. So this is just an overview of what I just stated. Men are 50% less likely than women to seek preventative care. Over 40% of men only go to the doctor when they think they have a serious medical condition. And then more than half of men said that their health wasn't something that they talk about. That was according to these statistics. So, but that's huge. If there's something that males feel like is going on, but they don't want to talk about it, they don't want to go see about it, or until there is at the last moment, okay, I've got to go. One of my acquired brothers was sharing with Mother and I last week that he woke up, I think it was about 4 o'clock in the morning. He had been hurting for a couple of days, and he had said to himself, if I'm not if this pain isn't gone in the morning, I'm going to the emergency department. Well, the next morning it still wasn't gone, but what he did, now of course he didn't call, but what he did, he got in his car and he sat in his car for an hour and a half. He never went to the emergency department, but I suspect he had a kidney stone from the way he described it to me. But he thought about it. He didn't talk to anybody about it except himself, and he sat in the car. Now, what if something other than the pain actually starting to go away had happened? He was in the car by himself. No one knew about it. So That's just an example of not really men not talking about. That's just one. So with the men's health focus, I want to talk about 3 B's. And I'll tell you now that the 3 B's that we're going to talk about is blood pressure, blood sugar, and blood chemistry. I'll mention blood chemistry a little bit, but then I'm going to come back to it. So let's talk about prostate before we get into that. So prostate health is an age-associated, the prostate is a gland, and it is age-associated that it tends to enlarge as men age, and it can cause trouble with urination. So some of the key clinical indications of a developing prostate problem can be difficulty urinating or dribbling, difficulty starting and stopping the urine stream, waking to urinate at night, having an interruption of the stream during urination, having unresolved back pain or pain on the inside of the heels. And on the inside of the heels is because if you put your hands and your feet together, your body is mapped out. So you have energy lines that go to the heels of your feet. And I know I'm using my hands, go to the heels of your feet that correlate with the back pain in the area that has to do with the prostate and your urinary system. When it comes to prostate problems, you can also feel like you're having a feeling of not emptying your bowels completely. So, and then the other thing is erectile dysfunction. When there tends to be a problem with the prostate as it escalates, then all of those things can escalate as well. So just a few more men's facts, and some of them are repeated. Men are more likely to die from heart disease at earlier ages than women. And men are at significantly higher risk of dying from liver disease. And that is can be variable reason as well. Not across the board, but many men drink beer, some form of alcohol, like many women drink water, I will say. So that impacts the liver, as well as when that occurs, it's affecting the blood sugar balance within the body, and it is causing, for lack of a better description, it's caused hardening of the cells in the liver, and it's causing fatty liver disease, where the cells are hard, they harden, and so the liver can't function properly. Another statistic is that 80% of spinal cord injuries occur in young men because of the events and the incidents that they are involved in. And then men have an increased risk of dying from diabetes, and that also can be correlated to the liver health and the choice of what to consume. So that's blood pressure. No, that was just some statistics. So let's talk about blood sugar. Apparently I took it out of order. So I know what I did now. So we'll go with it. So I want to talk about blood sugar since that's what's on here, and then I'll flip back and talk about blood pressure. So in 2020, this is the National Diabetes Statistic Report. So when it comes to gender, as a male, you're more likely to get type 2 diabetes at a lower weight than women. So what does that mean? For one, type 2 diabetes is the diabetes that is acquired because of lifestyle choices. So type 1 diabetes is the diabetes types when your pancreas just cannot secrete the insulin properly. So your blood sugar goes up and down, it's imbalanced. And most of the time anytime if a person is type 1 diabetic, they usually have to have an insulin pump so that they can get the appropriate amount of insulin that they need for their blood sugar level. Type 2 diabetes is usually from, like I said, lifestyle choices, and those can be modified. And there is a type 3 diabetes, which is Alzheimer's. That is like blood sugar diabetes of the brain because of the same thing, just as I stated that it does with the liver, it does it with the brains. It causes the brain, the cells to not be nourished, so they shrink and they harden, so the blood can't flow through there. The brain is about 3 pounds. I don't have the picture with me because I'm just now thinking of this. The brain is about 3 pounds, but as the diabetes of the brain happens, that brain shrinks. It literally shrinks. So if I were to have a 3-pound bag of rice and then a 1-pound bag of rice, then you can see the difference in that. And I've done that in some of the classes that I've taught. But type 2 diabetes, it says that lower weight than women, men tend to house belly fat well, women do as well, but men tend to get that belly fat as they age if they're not doing something about that. And with their lifestyle choices, again, for the majority, men do not do preventative things. So that's why the diabetes is acquired at a lower weight than women. So, and I kind of just talked about that without thinking about my slide. One reason is that men store more fat in their bellies, which is a known risk, and more men than women have diabetes that goes undiagnosed. I believe this is just in my world that I've seen a lot of males sometimes when they get their hair cut, they have something on the back of their head. I don't know, fungus, some kind of stuff that pops up sometimes. I believe that is an indicator, one, that the clippers may not have been cleaned. However, I also believe that that is an indicator of blood sugar imbalance. Whenever there's athletes' feet going on, any kind of skin things going on, that can be an indicator of blood sugar imbalance. And those are some of the common things in males. So men tend to have diabetes and it's undiagnosed. But the thing is about diabetes, when it comes to that, the blood sugar, of course, it is the main sugar found in the body, and you get it from the food that you eat. And sugar is an important source of energy, and it provides nutrients to the body's organs, the muscles, and the nervous system. But what happens is it's the wrong type of sugar, and it's affecting the bloodstream and our cells. So you can check your blood sugar by using a blood sugar meter, even if you don't have diabetes. I encourage you to do this. We have one here, and we periodically go through phases where we're monitoring our blood sugar because there is sometimes when I get outside of my eating norm, but I need to monitor my blood sugar because of the history on both sides of the family of blood sugar dysregulation and diabetes. I don't want to get into that. I don't want to get into that phase. So I do monitor my blood sugar if I'm getting outside of what I normally eat, because foods as a whole, there are certain foods that can cause your blood sugar to go up too much and it to stay up too long. So it's damaging your little vessels. That's why there's so many issues with vision. The capillaries in your eyes are damaged, the retina gets damaged. And when your blood sugar stays up over 110 for such a long time, you're already experiencing those issues to your vessels, not just your eyes, but all the vessels in your body are starting to be damaged by that. So let's talk a little bit about blood sugar. So blood sugar, the target range is something that they want you to keep it within. However, before a meal, now this is not my recommendation. This is the CDC. That's why I put it down there. But according to the CDC, before a meal, that means fasting, before you've eaten anything, your blood sugar, according to the CDC, should be anywhere from 80 to 130 milligrams per deciliter. So that's like if you prick your finger, if you get the blood drawn in your arm, whatever your blood sugar reading is, fasting, not having had anything for at least 8, usually 12 hours, it should be between 80 and 130. 2 hours after a meal, the start of your meal, your blood sugar should be less than 180, according to the CDC. Your blood sugar targets many different things depending on your age, whatever your target is. If you already are diabetic, then they look at the target range a little bit differently. If you are experiencing health problems, they look at it a little bit differently. So there's factors in where they have the target range. But according to the CDC, before a meal, your blood sugar should be between 80 and 130 and not above that. You're going to see that different here in a few moments based on my functional education and my life experience with family. So I hit the button. So let's see what that screen was. So basically, in a nutshell, what can you do about blood sugar? Doing as best as possible to keep it balanced. Eat a healthy diet. And I know that's broad. We can talk about that more later. Keep yourself at a healthy weight. Be physically active. Do not smoke. Limit how much alcohol you drink and get enough sleep. That's overall for that. So I am going to, because I want to talk about blood pressure. Let me stop my share or thing for something before I go. I wanted to mention blood pressure, but I actually wanted you, see, I have different PowerPoints. Okay, so I need to hop over here and get my other PowerPoint. So just bear with me for a moment. What's on that screen, Mother? Okay, good. So y'all just stay right there, and one more thing, and I'm going to show you one more thing. And while I'm looking for one more thing, is there any questions that have come up? If so, unmute yourself and ask the question while I'm pulling up this other thing. Where is my other PowerPoint? No questions? Speaking men's health, men's health. Okay. So we're just going to do this one. And okay, so I'm going to do a new share because I want to talk about blood pressure, and then we will come back to the other B for men's health. So your screen should have changed to National High Blood Pressure Education. Perfect, it did. So we're going to go over here and talk about blood pressure. We talked about blood sugar, and blood sugar is key because it affects your blood pressure as well. And I'm watching my time, so it's 10:55. So blood pressure, basically blood pressure is the pressure of the blood pushing against the walls of your arteries. Arteries carry blood away from your heart to other parts of your body, and your blood pressure normally rises and falls throughout the day. So basically what the numbers means, your top number is what's called the systolic. That's the pressure that is felt on your arteries when your heart beats. The bottom number is called the diastolic number. That's the measures the pressure of your arteries when your heart takes a momentary rest. Every one of our hearts take a momentary rest. So you have the systolic on the top, the diastolic on the bottom. Now, this is what I wanted you to see. So as of 2018, these are the blood pressure categories. So I want you to think about your blood pressure when you've had it checked, and as however frequently you have it checked, because your blood pressure and your blood sugar affect all of your organs. They affect your liver, they affect your kidneys, of course they affect your heart, and they affect your brain. So according to the American Heart Association, as of 2018, a normal blood pressure is less than 120 on the top and less than 80 on the bottom. It has to be the both of those for it to be normal. Less than 120 on the top and less than 80 on the bottom. That's overall. Now, that does not mean that when you go to the doctor's office and sit there for an hour or longer, or you're just nervous because of being there, that's called white coat syndrome. So your blood pressure may be higher than that. So it is ideal and preferable that they check your blood pressure when you get there, but give you a few minutes if it's outside of that range so that they can check it again. However, outside of white coat syndrome, outside of being at the doctor, outside of being irritated for sitting there or being cold or just not whatever the situation is, on a normal basis, if your blood pressure, the top number is between 120 and 129 consistently and less than 80 on the bottom, that is considered an elevated blood pressure. So if your blood pressure, I'm just going to make it real simple. If your blood pressure is 121 over 79 consistently, that is considered elevated because your top number is higher than 120. Did y'all get that? So that's elevated. Now, it goes beyond that. High blood pressure, you have stages, stage 1, 2, and then you have crisis. Stage 1 is when the top number is 130 to 139, or the bottom is 80 to 89. So, for example, your top number can be 130 and your bottom number can be 78. If that is consistent for you, then that is stage 1 hypertension. Stage 1 hypertension. So it can be either or. So your top number can be 128 and your bottom number can be 88. That's considered hypertension stage 1. That's consistently. So that's stage 1. So stage normal is less than 120 and less than 80 on the bottom. Elevated is anywhere from 120 to 129 on the top and less than 80 on the bottom. And then hypertension stage 1 is 130 to 139 or 80 to 89 top or bottom. It can be either or. It does not have to be both. So then you get into stage 2 high blood pressure, which on the top is 140 or higher consistently, or 90 or higher on the bottom consistently. It's either or for hypertension stage 2. And then you're in crisis, where if you just happen to be out and about, you go to like the drugstore and you check your blood pressure on the self-check machine. If it's higher than 180 and or higher than 120 on the bottom, then that is a crisis and you need to seek medical attention because that is extremely too high. You are nearing a heart attack and or a stroke when it is that high. So those are the blood pressure categories. But what I want you to understand and to know is that if your blood pressure is consistently higher than 120 on the top, even if it's less than 80 on the bottom, that is elevated. And there are people who walk around not knowing that their blood sugar is elevated, just as well as not knowing that their blood pressure is elevated. Or they've gotten accustomed to it being elevated and may not be aware that they're experiencing headaches or dizziness or just feeling out of balance, or their eyes are red, and they're not understanding why their eyes are red, or they're having just some dull ache, some dull, just not feeling right. Could be an indicator that the blood pressure is elevated, that meaning 120 to 129 or less than 80 on the bottom, and less than 80 on the bottom. So I just wanted to share that with you. So just remember, high blood pressure can be called hypertension. That's when your blood pressure is higher than normal. Your blood pressure does change throughout the day based on your activity. And if it's consistently above 120 on the top and 80 less than 80 on the bottom, it's still elevated. So get your blood pressure checked. That's what I encourage you to do. I think that's all that one that I wanted to share with you. So let me do a new share and go back to the other one so that we can go back to the one more thing. Is that on my screen, Mother? One more thing. Okay. So one more thing that I want to talk to you about. We talked about blood sugar, blood pressure. So we're going to talk about blood chemistry. So what is blood chemistry? Blood chemistry is the labs that you have when you go to the doctor. That is your complete blood count that you should have a differential with it. That is your chemistry profile. That is the thing that talks about your red blood cells, your white blood cells, your hemoglobin, your hematocrit, all those things on there, those MC words that you don't know, as well as the one that evaluates your potassium, your sodium, your chloride, your electrolytes, your electricity in your body. So some of the things that give you an idea of how your blood sugar is functioning within your body, some of the things that you see on those lab works are your glucose, fasting. It is recommended in the functional world that is 75 to 85. Now, remember I said the CDC said a fasting range 80 to 130. That is too high. 75 to 85 fasting, because if it's consistently the range for what CDC says, you're already having damage to your vessels in your body, which is making you more at risk for having damage to your organs, because it's damaging your cells, which is putting you more at risk for having fatty fatty liver disease. And you can have fatty liver disease and not drink alcohol. There is a non-fatty alcohol non-fatty acid liver disease, can't even get it out, versus the one that is caused from drinking alcohol. So, and then you have and that affects your kidneys as well, the vessels within the kidneys and those cells. Another thing that gives you an idea about your blood sugar, how it is ranging, is the hemoglobin A1c. Ideally, that it should be between 4.5 and 5.5. A good number to have is 5.2. And that measures what the average of your blood pressure is over 90 days, usually 90 to 120 days. So if it is 5.6, then your blood sugar is getting to be, I'll tell you here in a minute what that is. That means it's averaging over 110, probably like in the low 120s. So you're already getting damage to your vessels. The little vessels, your capillaries, your arteries, your veins, your eyes, your retina, your kidney, and your liver. And there is something that most people don't do, doctors don't do this on a regular, is a fasting insulin, to let you know how much insulin is in your body, if that's too high or too low, to let you know if you're deficient in with your pancreas secretion of it, or if your blood sugar is such that it is requiring your body to have too much insulin in it, which is going to lead you to be insulin resistant, where your cells are going to get tired of the call for insulin and the doors are not going to open to let it be secreted to lower your blood sugar. Triglycerides, most people look at that when they're looking at cholesterol, but triglycerides gives an indicator of your blood sugar balance as well, and metabolic syndrome. And I know I'm saying some big words, but these are giving an indicator of what is going on in your body when in relation to blood sugar. C-peptide, fructosamine, and then there's what's called antibodies for insulin, islet cells, and the a GAD amino acid. So those are some markers that you can get information about how your blood sugar is doing over various days that is on your regular blood chemistry. The ones that you're most familiar with probably are the glucose and the hemoglobin A1c and the triglycerides. So But remember, the CDC says the target range is 80 to 130. That's too broad of a range. In the functional world, it's more narrow. So the more narrow it is, the better it is for your body to be in balance. So the thing that I want you to know about blood sugar imbalance, you don't just end up with diabetes. There is a spectrum. You usually have hyperinsulinemia. That's why it's a good idea to have your fasting insulin checked, because if you're having too much insulin in your blood because your blood sugar is going up and it needs to be balanced to be brought back down, then many times it's going to cause what is called reactive hypoglycemia. So your blood sugar is up, your pancreas secretes insulin to bring it down, then it drops your blood sugar down too low. So now you're needing to eat something. Usually most people eat something that is refined and unhealthy, that doesn't last a long time, some quick simple sugar like candy, or drink some juice. So it's going to bring your blood sugar back up for a little bit, and then it's going to drop back. So then your body's going to secrete glucagon to help bring it up, and then when it gets up, it's going to secrete more insulin to bring it down. It's going to drop it too low, and that's a cycle. And when your pancreas is called on so many times to secrete insulin to balance your blood sugar, that's when you get to the insulin resistance, where you have doors, like you have a door in your house. Somebody keeps knocking at your door and you get tired of them knocking at the door, like the persistent widow. The man didn't want to open the door. The insulin receptors on your cells, they're not going to open until they get repaired. They need some nourishment. So that is insulin resistance. So you have hyperinsulinemia, reactive hypoglycemia, insulin resistance, and then your metabolic syndrome, which metabolic syndrome you can see on your blood work because of looking at your glucose, your triglycerides, your total cholesterol. You can look at even what's called alkaline phosphatase, that has to do with the liver, but it also has to do with digestion and zinc levels. So you can look at those things to get an idea. And if two of those, usually two or three of those, are out of range, then that's an indicator of metabolic syndrome, blood sugar imbalance. And if that spectrum continues, then that's when you're diagnosed with diabetes. So many of these things, like I said, type 2 diabetes is a lifestyle modification thing that can be it can be helped, but it's a matter of doing things to repair their cells, the insulin receptors on your cell, so that everything else can start to be resolved. And over time, like I said, there are many people, not just males, who are unaware that they have blood sugar imbalance or even diabetes. So the damage is taking place within their bodies. So imagine if you knew this information before now. Imagine if you had a better understanding of your blood chemistry. Imagine if you could understand why maybe you had those dull headaches or those red eyes, or just the heart palpitations, or why sometimes you may have had back pain, or sometimes maybe blurred vision, whatever. Imagine if you had those answers. Well, even if you haven't had them up until now, those indications, just know that there is information available and ways to look at what's going on in your body metabolically. And of course, you can seek out having sessions with me to do that. But just imagine how valuable that information is. Just within looking at your blood pressure, your blood sugar, and your blood chemistry, you can get answers as to why your body is expressing what it's expressing. But even to go deeper than that, back to 3 John 2, where he says, "Beloved, I pray that you may prosper in all things and be in health just as your soul prospers." Imagine how relieving and how releasing it is to get an understanding of why your body is expressing what it's expressing. There is usually some way to get an indication of why your body is expressing what it's expressing, getting to what I like to say, the root cause. And once you have an understanding of that root cause, then you're able to take measures to make it as best as possible for your situation, for your body, for your health, for your spirit, for your soul, for your well-being, for your totalness. So if you haven't done anything, or if you have something in the back of your mind, remember this is a focus on men's health, but it applies to everyone. If you think there's something not right, ask for help. Ask for help, whether that be your medical practitioner or someone else that you know that is skillful enough to help guide you. Even if they suggest you do a certain thing, ask for help. If you don't ask for help, no one knows that you need help, and we can't help you. So that is my topic on men's health for the month of June. I trust that it has been helpful for you. And right now I'm going to stop sharing my screen, and I'm going to stop the recording. So we'll have that part, and then I will see if there's any questions.